Hello and welcome to Lens of Hopefulness with me, your host, John Pasadino. In this episode, I interviewed David I. Joseph, author of Listening for a Lifetime, The Artful Science of Psychotherapy. For anyone who's ever wondered what it's like to be in psychotherapy, I suggest you listen and or watch, because we really sliced it and diced it, and David gave a wonderful inside view of what it's like. And if you've been in psychotherapy and have always wondered what the psychotherapist himself or herself is thinking, Dr. Joseph does that in this episode as well. He really gives a fascinating behind-the-scenes look. He did a fantastic job fielding all of my questions and examples. And at one point, we had a technical difficulty, and David just rolled with it and said, "Hey, leave that in." And we'll, because that's really how psychotherapy is. It parallels life. You have glitches and you need to adjust. So please sit back, relax, and enjoy the episode. And don't forget to subscribe to Lens of Hopefulness so you'll get all of these episodes delivered to your inbox. Thank you for joining.
Analyzing life.
Considering the answers.
Lens of Hopefulness with John Pasadino.
With guest.
Psychiatrist and author David I. Joseph.
Welcome, David, to Lens of Hopefulness.
I'm glad to be here and look forward to talking with you.
Thank you. We're a good match because you've spent 50 years as I'll say psychoanalyst, psychotherapist, psychiatrist, however we could, the monikers, we could get into the definitions later. And I've spent 50 years as a patient, so in psychotherapy. Okay. On and off since I was 16 years old, I've been in psychotherapy. So when I read your book, Listening for a Lifetime, The Artful Science of Psychotherapy by Dr. David Joseph, my guest, David L. Joseph, I identify with...
It's David I.
David I. Joseph. I identify with so much of what you wrote, and we're going to start talking about it. But first, I want to do a little primer, if you don't mind, is for people that have not been in psychotherapy for 50 years, what is the difference between psychotherapist, we hear psychotherapy a lot, psychologist, and psychiatrist? Can you give us a brief definition of those?
Yes. A psychiatrist is someone who's gone to medical school and then done specialty training in the field of psychiatry, which involves learning about the brain as well as learning about the mind, and being able to prescribe medication and to understand better some of the neurological things that are going on and that may be causing someone distress, whether it's depression or whether it's a manic episode or whether they become disorganized and it affects their thinking, so that they can have a better idea of what's going on in the brain as well as the mind. Okay. Psychologists are trained in how the mind functions. Not that they ignore the brain, but that's not where their education or training is, and their focus is primarily on providing psychotherapy. Some psychiatrists are well trained in psychotherapy. Some become psychoanalysts, which is a graduate kind of training in advanced psychotherapy, is one way of thinking about it. Mm-hmm. And they will have a considerable expertise in doing psychotherapy. Other psychiatrists don't. So you can't assume that. You really, there are real differences among psychiatrists about how well trained they are to do psychotherapy and whether they enjoy doing it.
Okay. I've been to all three. I've been to psychotherapists. Some are LMSW, master's degree, and the psychologists also have their different disciplines.
Yes.
And I've been to psychiatrists and psychiatric nurses who can write scripts. Mm-hmm. I find all three, there's overlaps, like you were saying. I've found that the psychologists had the most in-depth view of how the mind works. So it matches up with your definition, not necessarily for you as a psychotherapist or a psychoanalyst, but that's been my experience. And the reason why I've had that experience is because of the way patients are treated generally by doctors. There's a very limited amount of time. And the psychiatrist, just like an MD, if they look at your throat and they say, oh, you have strep throat, they're going to write a script for antibiotic. A psychiatrist, I have found, will go to the script if you're depressed and write you a Prozac or SSRI prescription quicker, because that's what they know to do. That's been my experience, like I said. A psychologist can't do that, and a psychotherapist can't do that, but a psychiatrist can. So I guess my point is that I have found that psychiatrists spend less time on how the mind works. Now, that's not you, because you have a book here that explains a great deal of how the mind works. And I want you to, that'll be the next phase of our discussion, is if you could talk to, and you have chapters on it in your book, which I have on my Kindle, how does the mind work? How do these traumas embed themselves, or these neuroses, or these depressions or anxieties? How do they develop and embed themselves in the mind? Can you get into that for us?
Yes. Before we do, I wanted to say something about the fact that most psychiatrists are quick to go to the script. I agree with you, depending upon when the person was educated. I mean, I'm going to be 85, and I was educated at a time in the late 60s and early 70s, when psychiatrists were learning a lot about the brain and about the prescription of medication, but they still got considerable training and education in being psychotherapists, and valuing psychotherapy, and understanding how much psychotherapy can change the brain. If one changes, it's not just your mind changing, it is your mind and your brain changing. We speak of them as though they're separate, but they're so interwoven.
Yeah.
And, whereas today's psychiatrists, most of them don't have a lot of training or experience in doing psychotherapy, in part because of what you said. Insurance companies in particular don't pay people for their time.
Yes.
Right? So if you come in and say you're sad because your dog died, and you're crying and not sleeping well, I can spend 15 minutes with you and give you some medication and make a lot more money than if I sit down and talk with you and we have a conversation for 50 minutes, and maybe then we'll meet again and we'll meet again. And so that's one of the main reasons why, if you're going to see psychiatrists, you have to decide what is his or her training and experience, and what do they value.
Thank you. And to your point, with the money part of it and the insurance, they also do now. They'll see you for us, and I'm saying this is generalizations, everybody, from my experience, by the way. And I thank Dr. Joseph David for clarifying his viewpoint. So, what I have found is there is an initial session. If I get to see a psychiatrist, there'll be an initial session. Will be the in-depth finding out who I am, what I'm about, what's bothering me, and maybe another one. Then I'm prescribed, and then it goes into medication monitoring. Then it becomes, I'll see you for medication monitoring. If that particular psychiatrist doesn't do the psychotherapy, they may refer me to a psychologist or a psychotherapist for continued therapy. So that's what I found. And that's to your point about the insurance. So let's get into your book, Listening for a Lifetime, The Artful Science of Psychotherapy. And I was saying in our little pre-production meeting, just reading the chapter titles, people, if you pick this book up, and if you're on Amazon, by the way, and you have Kindle Unlimited, you can get it in your Kindle Unlimited. So it's available electronically and in paper form. But I noticed that there are the titles, all of each chapter say something. that you could just read the title and learn something. Hidden pleasure is I'll just cherry pick one. Hidden pleasure is the deepest pain stemming from a shameful or guilty act. It's like a profound saying that could be on a meme, So I congratulate you on these little nuggets that point to the chapters. But I'm going to let you speak about how the book developed and what initiated the development of the book and the writing of it.
Well, the book was written in great part because of what you just talked about, that these little sayings, which I call aphorisms, that I created them over the course of my career. And I've done a lot of psychiatric education. I was the director of a psychiatry residency program at St. Elizabeth's Hospital, which is the big public mental hospital in the District of Columbia where I live. And I also had psychoanalytic training and did a lot of education at the Psychoanalytic Institute where I trained. And I hadn't considered writing a book. I'd written some papers. I'd given a number of talks. I was an English major in college and for a while considered becoming a literary critic, but that didn't really give me as much pleasure, and I'm not so sure how good I would have been at it.
Yeah.
When I went to college, I decided I went planning to be a psychoanalyst, which we can get into if you would like, the reasons for that. But then I ended up wanting to go to medical school, and I batted around in medical school with different kinds of professions I wanted to go into and came back to psychiatry. And maybe about 10 years ago, two of my students and one of my colleagues said to me, you've got this way of saying something very pithy and very meaningful in a short and memorable kind of phrase, and you ought to write a book. And when the third person said that, I said, I really want to write it. And so I gathered these aphorisms together over maybe a year and a half. I took my time, and when I said something that I thought was condensed and meaningful, I would write it down and then get a long list, longer than I actually included in the book. And I decided that I would organize the book around these aphorisms because I wanted to make it understandable, readable, substantive. I didn't want to dumb it down. I wanted it to be meaningful to anyone who was interested in the field, but I also wanted it to be stimulating and thought-provoking to my most senior colleagues. And so I use those aphorisms because they condense in a meaningful way some basic essence of the work of being a psychotherapist and the experience of being a patient and the work of being a patient. Being a patient's hard work.
Yes, it is. And thank you for the explanation of how the book developed. I want to bring up the cover real quick. Listening for a Lifetime, The Artful Science of Psychotherapy by David I. Joseph.
Yep.
And that's out on Amazon, folks.
That's my office, by the way.
Oh, okay, great. I was going to compliment you on the graphic because it's a very fitting cover, of course. And I was wondering how it developed. So I love the fact that it's real.
It's real. It's real.
So now we can get into the book. As we said, there's aphorisms. I like that word, that introduce each chapter. And I also want to talk about, since I just heard you say it, the work of a patient, how hard it is. And you refer to other, and throughout the book you say things like, there are people, like there's one example I thought of just now. I hope I got this one right. It was somebody that was having an issue, I think traveling, and it was in the attachment section of the book, attachment disorder, I'll call it. And the person was having anxiety over traveling, and you thought maybe it tied into something that wasn't the obvious. It might not necessarily be he's afraid of planes, it's something else. But that person didn't want to delve into it at the time. I believe that was the one, because there are patients that do not want to go there, so to speak. Do you remember that example?
I think you're combining two examples, but yes, I know exactly what you're talking about.
Okay. So that is the hard work of a patient, I feel, and I have been in the situation where I didn't want to, I'll say go there, that's my expression. I rather just let it be, and I have covered as a patient because it's too painful to talk about certain things. And so how do you coax that as a psychotherapist? How do you coax people to open up?
Well, first of all, I don't. I never coax anyone to do anything. And it's not, in my opinion, that it's painful to talk about certain subjects. It's risky to talk about certain subjects because you're going to make yourself vulnerable. But if you're talking with someone that you really feel safe with, that you really feel that person wants to help you mitigate the pain you're in, help you heal, and if that person has earned your trust, each of us wants to talk about these kinds of painful experiences because since we were born, we need to have a conversation with another person to help us metabolize whatever we're dealing with. And even if it's a baby talking with their mother, the way baby, I mean, even 6 months old and from birth. So we need that, but one really has to feel safe. Not that the person you're talking to is perfect, but that they're a trustworthy person who has your interest at heart. Then it's really deeply meaningful and a huge relief to share that aspect of yourself with someone.
Okay, and I understand that part. I think, like, what I was referring to, something like, say, grief, where I know it's just like when somebody passes away, for example, and you maybe put aside some photos because you just can't bear to look at them. And then when you go into psychotherapy, I'm not ready to talk about it, like that type of thing. But I also know what you're talking about, too, because for me, grief ties into fear of death. And now if I talk about grief, I'm going to have to address the fear of death. So now that's uncomfortable.
Yes. And that, I think, and there's a very influential book called Denial of Death by Ernest Becker. And I think that everyone's afraid of death. I think it's just woven into our being. And it's frightening to talk about it, it's frightening to think about it, and yet it's always on our minds in one way or another. And when you get to a certain age, the awareness that death is not so far on the horizon has a very different impact than if you're in your 30s or you're a child and you're 12.
Yes.
When death just doesn't. And yet, speaking about death can be very reassuring, too, if you're talking to someone who's not frightened to talk with you about it. Someone who can really not just listen, but who can absorb what you're saying and sit with what it stirs in them, the listener, then the two of you will have a conversation about death, even if it's a psychotherapeutic conversation. And you know, we kid ourselves if we think we can look away from something psychologically. We've just shut our eyes, but it's still there.
Yes. And I was thinking about a psychologist I once saw many years ago, decades ago, and it was, it was 94, when my father passed away in 94, and I was seeing a psychologist, and I was having a rough time with it. It was the first major death in my family, and it was a parent, of course. And as I'm speaking to him, we're in his office, and he has a picture of his father on the mantelpiece to the side, and I saw his eyes go up and look at his father's picture. As I'm talking about my father, I saw his eyes well up, and he kind of looked like he wasn't ready to talk. And then I realized afterwards, I had seen his brother also for chiropractic, and his brother said their father had just passed away. So as I was talking about my father passing away, he was processing. His eyes were going up to his father's picture, and I could tell he was like a little uncomfortable talking about it. And we got into it later on, and then I said, "Oh, I'm sorry, I didn't realize your father passed away." But I'm mentioning this because the dynamics of the doctor-patient relationship, of the psychotherapist-patient relationship, are so deep.
It's a beautiful example because the notion that a psychiatrist or a psychotherapist or a psychoanalyst doesn't respond emotionally and deeply to what the person who's in their office and sharing their innermost thoughts and experiences, that's it's not true, and it's very destructive, because you can't be a good therapist with anybody if you're not willing to have your emotional heartstrings plucked. I have an aphorism in the book that says the mind is like a harp, and over the course of one's career, a psychotherapist will have patients pluck every string in the harp of their mind, including some they didn't know were there and some they wish weren't there.
Yeah.
But your example about someone who's just lost his own father, he may have been too raw in the moment.
Yeah.
To really be with you in the way he needed. And it depends upon how painful it was, but at least in my opinion, if suppose my dad had just died, it would be too raw. And if you came in and told me your dad had just died, I think I would have said to you, and I've done this occasionally, not around death, but said, my dad just died, and you need to talk with someone for whom it's not so raw, because I'll do ways that will I'll act in ways that will shut you down. I don't mean to, but it was just human nature, because it's too painful for me right now. So
Gotcha.
Let me refer you to my... And I'm quite happy if you include this in the podcast. One of the things that I think is very important as a psychotherapist, but also as a patient, is to be prepared for and welcome surprises, and certainly be prepared for them, because it's often the unexpected, particularly in the experience of psychotherapy.
Yes.
That there has to be room for the unexpected, for the things that have been hidden in the shadows, and sometimes it's really disruptive, like this, and sometimes it's simply unsettling in a good way, because it catches you off guard.
It's as it was happening, I was saying to myself, is this happening for a reason? Is it because I'm generating energy from talking about all this stuff? You have that new age thinking of
Sure.
hitting little energy spots in the universe and all that.
and that's a very nice model for psychotherapy, because if someone says, I want to pick up where we left off, it's impossible.
Yeah. I mean,
that's just a wish that there would not be the separation and the separateness of two people. And so, if I see somebody, even if I see them the next day, I've lived 24 hours of my life, and so have they. So of course we're not going to be in the same place, even if we wanted to.
And I've experienced psychotherapists who I couldn't believe the detail they remembered. And then there were other psychotherapists that I say to myself, does this person even remember anything about me? And I shouldn't laugh. I'm laughing because it's kind of silly. Some were just not very good, and they didn't retain. And I was like, I can't believe I have to make this very important point again. But others were spot on. Now, it could be due to technique. I suppose there is some technique to remembering. I mean, of course, there's notes. But how do you retain so much information when somebody's talking to you for 45 minutes?
It's a really good question, and it's I never took notes during a session. Never took notes because for me it interferes with my ability to listen in the way I want to listen. And I didn't take notes afterwards either, unless it was something that was very important that I might want to think about or write about, because I assume if I listen well and speak meaningfully to my patients, that between the two of us, we'll remember what we need to remember. And it's what I call psychoanalytic remembering, meaning you really listen, you'll tune into the wavelengths you need to, which will take you to the material you need to remember. And so it's not that I have such a remarkable memory, at least that's not my view. It's that I can listen in that kind of way. When I read something, I'm someone who has a really poor memory for what I've read. I've absorbed the knowledge, but I can't tell you where it comes from.
Yeah, that's how my brain works too. I actually met somebody yesterday at a gathering who his brain is wired a certain way. I don't know the name of it, but he's able to, you could just name a date. We were testing him. We named a date in 1972, 1973. He was like, Watergate, Nixon resigned. Like, he knew every single historical item that happened. And we said, how are you doing it? Well, he said he couldn't remember individual items. If we gave him a grocery list, he wouldn't be able to remember it. But he's able to remember that way because he said one time he saw a neurologist and they had a name for it. It's the way the neurons connected or something in his particular brain. Yeah. And so
they used to call it, some of these people, idiot savants.
Right.
Right. They could say what day of the week in 1911 was February the 3rd, and they would tell you.
Yep.
Heaven knows how their mind worked that way, or they can remember everything. My mind doesn't work that way at all.
And, so I was thinking that it could just boil down to two, in terms of psychotherapists and whether they remember it or not, is that they are just not good. Like you said, you can remember what you read and you know the knowledge, but you're not able to go back to specific, say, chapters and verse. But it is disconcerting as a patient because you're laying it all out there on the line as a patient.
Absolutely.
And it kind of breaks that. I mean, it reminded me of another story, because I have so many of them, because I've seen so many therapists over the years, of another psychotherapist that when I said my brother, I went into counseling again in 2024, the background, because there are gaps. I don't go continually because I've reached what I call like psychotherapy burnout. Like, I've talked enough. I need to get away from this and live and practice what I've learned. But my brother had passed away suddenly January 2024, and my grief hit me like a truck. So I signed up. And today with benefits, we were talking about insurance before, you could just, there's a list of like 100 people. And if it's telehealth or, over Zoom, you can get psychotherapists from all over the country over Zoom. You just pick one, boom, and they'll read a quick bio. And I didn't even read the bio. I just like, this one's available. I need to talk to somebody. Talk to the person. I said, my brother passed away. I'm having trouble processing. All right, I'm going to have you fill out this questionnaire. And then later on, I said, she didn't even say she was sorry. So I was like, that was really weird. Maybe she didn't hear me. So next time I said, so since my brother passed away suddenly 3 weeks ago, they found him in his chair, sitting there. He was only 66. It's like, all right, let's get into page 2 of the questionnaire. And she went down the line. And then I read her bio. It's a similar story to before. It said she got into psychotherapy because her father passed away suddenly. Now, back to your example of that might have been a psychotherapist that might have said, I'm not good with the grief stuff, so maybe you should go see somebody else. I would say something quite different, John. I would say that this is a lousy psychotherapist. I would know more
give a patient I give a patient a questionnaire before I'd met them and talked with them a long time. I never have given a patient a questionnaire and never would, because I'm not interested in having that kind of relationship with them. I would like to get to know them by what they share with me, not when they write down on a piece of paper.
Excellent. Well, I have to say, the questionnaire went on for 3 sessions in a row. It was right down the line, and I was going to quit after the second session, but I was so hurting. I was like, I might as well finish like these questions. So, how many hours a night do you sleep? Let's see. Since my brother died, it's been hardly any. Are you getting the hint? But I followed through. And then I subsequently dropped her because I was like, yeah, this is not good. I had spoken to a couple of people, and they were like, really? Drop.
Right.
Anyway.
Right. And there are too many people who do that. It's not uncommon.
I have another example for you. Since, as I said earlier, I have the 50 years as a patient, you have 50 years as a doctor. And I'm kind of like lobbing these examples at you to get your impression.
I've also logged a lot of miles as a patient.
Okay, good. Oh, I'm glad to hear that because that's necessary for all us humans. I actually yeah, go ahead. Sorry.
I think so.
I actually had a psychiatrist avoid me. I kept trying to, she was like ghosting me. I was trying to make an appointment. And she's not available, not available. And finally I got in to see her, and she said, I said, I haven't been able to make an appointment. And she said, well, to be honest with you, you've been so draining. And I just stared at her. I was like, what? And she was actually crying. And then she left the practice. So she was having some kind of a breakdown, I believe, herself. Mm-hmm. She left her practice. But I was hit like it hit me like a truck. I was like, wow, I am that bad that I actually drained my psychiatrist. I actually made my psychiatrist feel bad. It's almost like out of a comedy. I could put that in the book, like a Woody Allen comedy or something.
I was going to say Woody Allen.
Yes, it was very Woody Allen.
But it's an example. It's a painful but really great example of where this person, at least at this stage in her life, couldn't make herself available to you as the kind of person in a relationship that you needed.
Yes.
And better that she would say to herself, and I'm going through something right now, and I just can't be the kind of therapist you need. Let me refer you to my colleague.
Exactly. It happened eventually, but, when she announced that she was leaving the practice, it was like a few weeks later, and apparently she was going through a divorce or something. But again, it was disconcerting to go through that. And I do feel, yes, professionally, it would be good to have a template, a script to follow in that case. Like, I am not doing well, so I am going to put this little, just like you go to a website, we're currently down. Go to this place if you need further information. So it'll be like, I'm a psychotherapist. I'm currently, like, my computer went down. My system has gone down. Please use, this other person, until circuits are back online. Mm-hmm. Now, I want to cherry pick one of your other, we're doing this free association thing here, and I do actually want to talk about psychoanalysis more, because it's been, before I go back to the book, which is, by the way, Listening for a Lifetime, The Artful Science of Psychotherapy by David I. Joseph. And it's a great book. I really enjoyed reading it because, and for those who are listening who haven't been to psychotherapy, David hasn't paid me for this pitch, by the way. I'm saying this as a person that's been in psychotherapy, and I've met many who haven't wanted to because they're concerned about it and what's it like, and are they going to shrink my head? That's old school thinking and all that. Well, read this book, and it goes through every aspect, I feel, of psychotherapy, including real life examples. So I highly recommend it. Anyway, I wanted to get into psychoanalysis because psychoanalysis has been knocked. And instead, there was I'm going to say it's a new wave of psychotherapy called cognitive behavioral therapy. I think we talked about it in our pre-production meeting. Albert Ellis was one of the candidates of it, so pioneers of it. And his approach was, because my brother was a patient of his, is just say, get over it. So what, your mommy treated you bad. Get over it. Just move forward. Without, and there's no analysis. It's just basically buck up and move forward. Your mind is causing all your problems. But not addressing why the mind is causing problems or what the underlying issue is, it's basically suppress the subconscious and override it and move forward. That's my interpretation of CBT. But let's let you now clarify what I'm saying from your perspective.
Well, I mean, Albert Ellis was a very self-confident guy. I know a little bit about him because I had to give some comments on his work, and in order to do that, I had to read some of his writings. And he actually was trained and he certainly was in analysis and had some training as an analyst, and then became disaffected with it and developed his rational emotive therapy and to get over it. And two things about it. One, there are aspects of psychoanalysis that one finds in cognitive behavior therapy. I mean, cognitive behavior therapy can be thought of as you're desensitizing yourself.
Yeah.
And most example, if you're afraid of spiders and you work in an insect business, and it's a family business, and so you can't leave it. Cognitive behavior therapy will help desensitize you to spiders. You won't ever come to like them, but you won't be afraid of them. But psychotherapy and psychoanalytic psychotherapy, where one talks about things that are really upsetting and frightening and destabilizing, when you talk with somebody who can really be present and listen and respond in a helpful way, helping you to understand and validating what you're experiencing, you become less rattled by, less destabilized by whatever it is that you're thinking or feeling. So there's much more overlap. And the relationship between a cognitive behavior therapist and a patient is much more important than most psychotherapists of that stripe think it is. And so, yes, psychoanalysis takes a very different approach to helping someone work through, my metaphors, metabolize whatever it is they're dealing with so they can learn to deal with it in a different way.
Yeah.
It's not that you avoid it. It's just that if you're grieving your brother's death, you can manage the grief in a way that seems more helpful to you. It's a different way of adapting.
Yeah, I was thinking too of I'm going to say from my perspective as a patient, as a person, I remember Wayne Dyer came out with a book, Your Erroneous Zones. That was a changer for me, a life changer, because he got into that cognitive behavioral therapy where he, it's, and there was another one too, M. Scott Peck, I believe he was a psychiatrist.
Yeah.
That wrote in these terms that were easy to understand, and basically the approach was, it's the old, your mind is what you are what you think. Okay, I'm going to capsulize it, say you are what you think. The problem with that is that I found as a patient is you're telling me I am what I think and I'm thinking wrong. So do I have a problem? What is making me think wrong? What is the root of me thinking wrong? And like I said, the approach I found was, well, don't worry about that. Don't even think about that. So what? Maybe it was your mother. So what? Well, I feel that if I don't address my mother, it'll always keep coming back. It'll keep coming and coming and coming. No matter how much I try to override with the affirmations, the memory of my mother, and I'm just using this as an example, it could be my mother, could have been my father, or it could have been my brother. Something that happened when I was a kid, or the way she treated me when I was a baby, or something, or maybe she was going through a tough time, that caused something to occur. And it keeps bubbling up, and I need to find out why. It could have been attachment. I was left alone in the hospital or something like that. And, oh, okay. And I'm going to keep going here. It's almost like a therapy session for me here. I actually did find that at one point. I made that discovery on my own about attachment and all that. I thought back to when I was in the hospital having my tonsils out when I was 4 years old, and my parents walked away. I remember them turning their backs and walking away. And then they put some kind of anesthesia over my mouth. And I remember smelling it, tasting it, and it went black. And I think could have been where my attachment issues started. They walked away, and I developed a mistrust. Anyway, so I discovered that on my own. No psychoanalyst no psychotherapist ever did, because I don't think they were, the ones I saw were able to dig that deep.
Well, they may not. I mean, you're raising a lot of very interesting and I hope useful things for us to talk about. First of all, I think it's hurtful to think that somebody is thinking wrong.
Okay.
One of my aphorisms is, someone's thinking or behavior seems irrational because we don't understand their rationale.
Good. So
it wasn't in my mind that you were thinking wrong. The question is, you weren't thinking in a way that made the most sense to the person you were talking to, the therapist or the analyst or the psychiatrist that you were talking to.
Yeah.
And they didn't understand, so they would say, you're thinking wrong. Somebody else would say, that's crazy. For me, it was, well, how did you develop this way of understanding what's going on? And your example about remembering the experience of having your tonsils out, and I had my tonsils out about the same age. I was a little older. I don't even remember it. But it's very traumatic. Both it's A, your parents are abandoning you, and B, someone's going to do something to your 6-year-old or 4-year-old body, and your parents are leaving you.
Yeah.
That's a traumatic experience from multiple perspectives, and plus the fact that all children are self-centered, and in part they think, what did I do wrong? Why are mommy and daddy leaving?
Yes.
And that becomes part of your mind and part of your brain. You can't erase what's on the brain. You can make it have less impact. You can understand it in a different way. You can adapt to it differently. But you can always get triggered if circumstances are right. And what a good psychotherapy does, it means you're much less vulnerable, and you learn to deal with and manage these situations without as much stress. Good analysis of my example.
I was thinking of another one. I have so many, like I said earlier, and that is about my hypochondriasis. And this goes back to my late mom also. When there was so much tension in the home, and folks, you're getting a real life examples here. I'm lobbing them up and throwing them at David, and he's hitting them out over the fence for me. There was lots of tension in my house, money problems and whatever, relationship problems, multiple kids, lower class, just living check to paycheck. My father worked 3 jobs and all that other stuff. And my mother seemed upset, angry. But when one of us got sick, she turned into an angel. She was nurturing and sweet, and all the other stuff went away. Now, this is what I discovered later in life, that I was manufacturing or exaggerating symptoms because she would change. That's when I got her to change. Okay, I'm going to turn mom back into the angel. Now, I didn't realize it at the time that I was doing that, but it just happened. And lo and behold, I've been married for 42 years. I found myself doing it with my wife as an adult. And now I don't do it anymore because it's not fair. I and I've understood why. But that is an example that it was another self-discovery.
Yeah, and it's not just that it's not fair, although I agree with you, it's not fair. It's not fair to you that if you want to be cared for in a certain kind of way, you don't have to do it the way you did as a kid because your wife isn't the same person as your mother. And yes, if your mother became much more nurturing when you were sick, of course, any child will say, hey, wait a minute, this is the best way to get what I need. But it may not be the best, and I'm going to have a reflex, a mental reflex to do that. But my wife's a different person, even if there are ways in which she's like my mom, and I can get what I need from her differently, and she doesn't respond the way my mother did. She doesn't like it. But and this is where being a psychoanalyst and the way I think is, it's helpful for you to realize that you learned this technique for a reason, because that was your way of managing the relationship with your mom.
Yes, exactly. So that was just for everybody listening, you just took my example and you psychoanalyzed it, would you say?
I would say I took your example and conceptualized it from this perspective of a psychoanalyst who thinks about child development and thinks about aspects of how our minds work that are less than fully conscious, and to realize that our prior experiences shape how we're likely to respond in the present, but that we're flexible people. We can learn until we're dead, and we can change until we're dead.
Well, I have to tell you, you just changed my view of psychoanalysis, because I never had a good psychoanalyst. Like I said, I've had psychotherapists, psychologists, psychiatrists, but I made those discoveries on my own, just from years and years of going through generalized anxiety and panic attacks and seeing my patterns and seeing the way and thinking back the way my mother acted, the way my wife acts and acted. And that's how I saw the patterns. But it wasn't picked up on by others. They either prescribed medication or used the cognitive behavioral. No one's ever died of a panic attack. That's what I would get. Well, I had another panic attack last night. Well, no one's ever died of a panic attack, so just keep that in mind.
And that could be somewhat reassuring, but it doesn't take away the panic.
Exactly. It never took away the panic.
And plus the fact, on some level, it'll say no one's ever died from it yet, but I'm going to be the first one.
And I have said that. I want to talk about something else. I'll grab one of your chapter titles, and it stuck out of my mind. Chemical imbalances are the spices of life, you say. So let's talk about these chemical imbalances, because there's another issue that I hear about. Don't take medicine; it'll cause problems. And no, you could think your way out of it. Okay, I've said enough. Talk to me about chemical imbalances in the brain. Us, I should say, our listeners, about chemical imbalances in the brain and why sometimes they may require medication. A person may require medication to fix that issue.
So I came up with this aphorism because I kept reading about, let's just say, depression. Depression is the result of a chemical imbalance. And that was really getting a lot of airtime as a way of understanding and making sense of depression. And on the one hand, it makes sense, right?
Yeah.
Something's imbalanced in the brain, or the person wouldn't be so depressed that they're in tears all the time and they can't get out of bed and they're tempted to drink and whatever. So it says everything, and at the same time, it says nothing. Chemical imbalance is part of being alive. It's the spice of life. I mean, in some small but significant way, you and I are having a chemical imbalance because I don't usually have this kind of conversation with someone on a podcast. How is my chemistry different? I don't know, but I'm sure it is. And if I were really super anxious and vulnerable, I don't think I'd be able to think as clearly or talk with you in this kind of way. So for me, the question isn't to think about it as a chemical imbalance. It is, why can't the person regain their balance? And it's important, depending upon the stress and the trauma. If it's a traumatic stress, it takes time to regain one's balance. It takes supportive people besides oneself to be with you. It takes many qualities. And sometimes one needs medication to help rebalance one's biochemical or state of mind, because a relationship alone isn't enough to do it. And so then medication is very helpful. But going back to thinking about the time you said, well, a psychiatrist would see you for 2 or 3 times, then prescribe medication and refer you to a therapist. My point of view, it would be, I would have wanted to talk to you for a longer time to see if our talking would help you regain your balance and rebalance your chemicals in an enduring fashion without medication. But medication is neither good nor bad. It's good to take it if you need it, and it's bad to take it if you don't. And that's true for an antidepressant or an antibiotic if you have a virus. It isn't good to take it. But if you need it, if you need it, you need it.
Yeah, it goes back to the over-prescribing of antibiotics at one time, and now...
Absolutely, right?
And there was an over-prescription of prescribing of oxycodone and painkillers and all that. So it goes... And look, in many ways, let's say antidepressants or anti-anxiety agents in particular, they're pain suppressors. It's just mental pain. And the brain doesn't like pain. And the question is, do you need a pharmacological agent, like if you've broken your leg? Yes. Do you need an antidepressant if you're really sad and the pain is so great? That depends, but it's not a value judgment. You need it. If you need it, you should be prescribed. And if you don't need it, it's like any other medication, better not to take it. If you've got another way of dealing with what's causing it. Yeah, and I've run across doctors over the year that from both sides, they overprescribe or go right to the pad, or they will not go to the pad right away and say, especially with the benzos,
the benzodiazepines. Yeah,
yes.
That's somebody feels mildly anxious, and someone says, "Here, take some Librium, take some Valium, or any of the newer ones." Well, I'm not opposed to giving it if the anxiety is really quite crippling, but if a person automatically takes a medication, among other things, they undermine their own self-confidence because they think, well, I can't manage anxiety without my Librium or my Valium. And that may be true, but it may not be true. And a good psychotherapy helps one develop the ability to manage and metabolize their anxiety without necessarily resorting to using meds. And medication has its own side effects. So does psychotherapy. But the question is, if you need medication, you should take it. But if you don't, why would you want it?
Right. I mean, I've been at the points where I carried a Xanax tablet with me because I want it with me in case I need it. and I won't even leave home without it. I'm a panic attack sufferer, still on occasion, but I was a panic attack sufferer. They were coming often. So I became dependent on just having it. It was like having it with me. Almost like the magic pill that would save me. That's the way I saw it. But in reality, taking that in the throes of a panic attack, by the time it was taking effect, I was already coming out of the panic attack. But anyway, that's a whole other topic. I wanted to talk about transference real quick, and it goes back to something we were talking about earlier, how, sometimes a psychotherapist was not in the right frame of mind at the time to treat somebody. But like in the terms of grief, we talked about the psychotherapist who had just lost his father, and I had lost my father, so it wasn't a good match at the time. But what about transference, where the psychotherapist is actually absorbing the symptomology? I would say, I don't know if I'm using the right words. They're absorbing the emotion or the pain of the patient. What happens in that case?
What happens to the patient? What happens to the therapist? What happens to the relationship?
Well, I think, take one at a time. Let's talk about the therapist first. How do you withstand that when you are feeling that transference of emotion from the patient?
Well, first of all, if I'm feeling it, and I'm responding by feeling sad and feeling concern, it means to me that I've really listened and heard and have a much better understanding of the kind of pain the patient is feeling. I understand it and know it in a physical as well as a psychological way. And that will help me be able to respond to that person in a way that will alleviate their pain. It won't remove it. It'll either alleviate it, it'll help them be less frightened by it, it'll validate why they're feeling the pain, it will affirm and make sense about why they're afraid of it, if that's what the issue is. And that kind of relationship and understanding helps the patient manage whatever they're going through. So for me to understand them, I have to have a taste, and it's got to be a pretty meaningful taste of what they're experiencing privately.
And how do you keep it from impacting your life? If you're listening to patients all day, how does it not bring you down, for example, if you saw a string of people who are suffering from depression?
Well, two things. One, I have to have in my mind, not in a conscious way, that I'm not responsible for living their life. I'm responsible for trying to understand and be present and not back away from what they need to share with me. That's one thing. I have to have the conviction that my ability to do that helps them not be afraid. If I don't pull back, then they won't have to be as rattled and destabilized by what they're experiencing. And I have to have the conviction that as the two of us talk over time, that both the depth of sadness and the person's ability to manage it will change in a good direction. And if it doesn't, that's, for example, then I might well say, hey, look, you and I have been talking for however long it is, and you're still really often in tears and so forth. And I know you didn't want to take medication, and I didn't want to prescribe it right away, but I think it would be helpful. Does it mean you'll be on it the rest of your life? Not necessarily at all. But if you need it now, and it will be helpful now, it's not a sign of weakness to take it any more than it's a sign of strength to turn it down.
Excellent. Good answer. I wanted to let's remind everybody, because we're coming down to the end here. I am talking to Dr. David I. Joseph, and his book, I'm putting the cover up for those on YouTube, is Listening for a Lifetime, The Artful Science of Psychotherapy. It's available on Amazon. And we've covered so many topics, and I can go to each one of these chapter topics and talk to you, but then you'd have to probably charge me an additional copay. I'm just kidding. Co-insurance. But so I will ask a final question, and that is one that I ask when I have this group that performs, and at the end of the show, I say to each cast member to say in front of the audience, "What have you learned?" And they say, "I learned," and they do like a callback to what they learned. So I want to ask you, and it's a kind of a broad question. You have 50 years in psychoanalysis and psychiatry. What is the biggest takeaway for you as a person? What have you learned from your experience about humans and life? And just another piece of that, how has it helped you as a human, your experience? Does that make sense to you, that question?
Yeah, well, it makes perfectly good sense. I think what I've come away with after years of practice and teaching and working in many different settings is, first of all, something that Harry Stack Sullivan, who was a psychiatrist, a rather difficult man, but it just goes to show that difficult and troubled people, among other things, he was probably an alcoholic, had some very thoughtful things to say, one of which was, we are all much more simply human than otherwise. And that's been deeply meaningful to me, and organizing in every situation I've been in, including working on an inpatient service in an acute psychiatric hospital where people were flagrantly psychotic and paranoid and delusional, agitated and so forth. It's been very meaningful to me, and I think very healing to patients, for me to realize these are people who have certain kinds of symptoms and problems, and it's affecting their mind and their brain in this way, but they're much more like me than otherwise. So it's both humbling and humanizing the other to me, and it humanizes the other person, and that's at the center of all my relationships with everybody, but especially with patients. And the other is that when we're under stress of any kind, we're much better able to manage it more quickly, more effectively, and more thoughtfully if there's someone we can talk with about it. Because when we're under stress, it's hard to get perspective on what's going on. That's just true in general.
Yeah.
I mean, it's particularly true. You've had panic attacks. When you're having a panic attack, you have no perspective.
Right.
And you feel like you're going to die.
Yes.
And whatever aspect of yourself says this is a panic attack gets steamrollered by the experience.
Exactly.
So those three things have really been sort of anchors for me, sort of points of a triangle that keep me focused in many kinds of situations, not just in professional ones where I'm working with a patient.
That's thank you for that comprehensive and insightful answer. And I want to say that I admire, so again, folks who are listening, I'm a 50-year patient of psychotherapy on and off since I was about 16 years old when I had my first panic attack, by the way. And I got to see a psychiatrist, and he had a bust of Sigmund Freud in his office, and he had a beard, and he stroked his beard, and it was like a stereotypical. And I wasn't able to talk to him like I'm talking to David now. I was just, I was frightened. I was like, something's happening to me, and I don't know what it is. And so anyway, so I can tell you emphatically, I have tested David today on this podcast. I've thrown a lot of real life examples at him, and he's answered so intelligently, and I could hear his experience. And I will go back to, and thank you for your service. We often say that to veterans. Of course, it's a different category, but thank you for your service, because you've served people for 50 years. And I think that's for people like me, I truly appreciate it. So thank you.
Well, you're welcome. But it's very gratifying to me to be able to be helpful to people. It's gratifying to me that you found our conversation today meaningful and stimulating and enjoyable. Mm-hmm. So it goes both ways.
Great. And it's all, much of this is chronicled in the book, Listening for a Lifetime, the Artful Science of Psychotherapy, Dr. David I. Joseph. And this has been the Lens of Hopefulness podcast with your host, John Pasadino. And once again, David, I thank you. And I have a great rest of the afternoon. And thank you again for joining me.
Well, thank you for inviting me. I've enjoyed talking with you. And I hope your listeners have enjoyed this conversation with them. I'd like them to think they've had a dialogue with me, too.
Thank you.
This has been Lens of Hopefulness with John Pasadino.
Streaming on all platforms.
Spread the word.